Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hi everybody, my name is Dr. Ellen Seppi. I'm here with you live from Littleton, Colorado, to address a really important topic of conversation, which is what kinds of interventions could be helpful for your patients in addressing weight management. Where do we start this conversation as physical therapists? I have my very good friend Dave here with me. He's off camera, and we're going to talk through some advice in his journey using NOOM, and this, which if you're unfamiliar with, is a cognitive behavioral therapy app that's used for a lot of different things, including weight management. We're going to talk through his use of this app and how it's changed things for him and his overall experience with it. So Dave.
Yes, Ellen.
Welcome to the party.
Thank you.
We're glad you're here.
I'm glad to be here.
Thank you so much.
Yeah, glad to be here.
Thank you for making yourself available, and I hope you know that I really appreciate you doing this to help other people and other PTs learn how to help their patients better. So, Dave and I are good friends, and I have treated him, and a few months ago, he was really struggling with a few aspects of his health that impacted his weight, and we kind of had this topic of conversation about using NOOM to help address that. And Dave, I think a lot of PTs are really uncomfortable talking about weight. How did it make you feel for me to bring that up?
It was enlightening, actually. You knew me before I was diagnosed with the cancer I'm dealing with. And you saw me progress and gain the weight. So you experienced that with me. And I obviously on more than one occasion said something to you, and you knew it was bothering me. And you as my healthcare provider, you know what, Ellen, I would trust you. I trust you as my healthcare provider. If I didn't trust you, you wouldn't be my healthcare provider.
Right.
You're one of the many that I have in this journey that I'm going through. And you straight up just asked me if I would consider it. Yeah. And I said, well, explain it to me. And you were able to explain it to me, I think, based off of your experience as well. And it sounded very interesting because it's not the way you explained it to me. And as it turned out to be, I've been doing it since December 22nd. You actually helped me put the app in my phone that night. I remember distinctly. It's not a diet. Mm-mm. It's not. It's behavioral. Like you said, it's a program that helps you change your mindset and your habits about food and how you see food is really what it is. Exactly.
And it's not really, it doesn't make foods. So the app that we're talking about, if you're just coming in, is called NOOM. And it's an app that uses cognitive behavioral therapy, which is a therapy technique used in a lot of different environments to kind of address what thoughts and patterns of behavior are helpful for you and what thoughts and patterns of behavior are not helpful. So it kind of addresses habits and eating in terms of a habit, not just nutrition in, calories out. It looks at your habits to build that up. So for me, my experience at the beginning of the pandemic, I was like, things are not going to go south from here. And I really took a look under the hood to say, how am I eating the way that I'm eating? And like many people, managing my weight was important to me. I wanted my big why. They ask, what's your number one why? I wanted to look like I practiced what I preached. And so I did NOOM for about 3 months. And it gave me a really great perspective on how to help my patients. And I think being vulnerable about that as a clinician probably made it easier. Like I wasn't telling you what to do. We were a team working together for a problem that we had both, as athletic, active, healthy people, had been facing. And we wanted to work on it together. It wasn't me telling you what to do. It was me saying, hey, I've been here before. Let me show you what's worked for me.
You could have brought it up without your actual experience with NOOM, and I still would have believed in it and felt the value that you were telling me about it. Again, I think it goes back to the relationship that I have with you as my PT, as somebody that I trust explicitly with my health. So your experience, awesome. I think it made you able to tell me a little more about it for sure, but I still would have investigated it.
Right.
I love the fact that you say cognitive, I say psychology based, right? It's psychology based. And it holds you accountable with lessons every day. I love to read. I do the maximum amount of reading in the app that you can do in a day, which is anywhere between 13 and 16 minutes worth of lessons. And it's those lessons, 16 minutes a day.
I mean,
literally.
As soon as we thought about it, I was like, you're going to love this.
Yeah.
Because everything that you do with so much enthusiasm and passion. Yeah. It was a no-brainer for you to do this app. And can you tell the listeners on Instagram and on YouTube how much does it cost? Is it affordable? Like, how did it start for you?
It's very affordable.
Okay.
I don't know if NOOM is going to want me to tell you this,
but
you're
going to be a testimony.
I just went in and did it. I paid the $156 for however many months it's going to take. Yeah. You take a quiz at the beginning.
Yeah.
And it asks you a lot of personal questions, what you're dealing with, hormonal issues, which obviously that's my biggest issue. Right. I'm dealing with hormone therapy, and I put on a massive amount of weight. And it takes into consideration all of those things, and it actually builds a program specifically for you. And then it also has counselors that are available to you. Right. Well, I will tell you that if you go in and you take the quiz, you put in your email, don't answer them back for a couple of days, and they're going to offer you the program for free.
Oh, you're thinking ahead.
Yeah. Now, I don't know how long they'll let you stay in the program, but it at least allows you to get a taste of what the program is, and you for yourself decide whether you like it or not. Yeah,
see, I didn't do I think I did 3 months total, and I wasn't as good on the lessons as you were. But for me, even little snippets of like, okay, yeah, you might be feeling like you're eating too many. So the app is like basically a calorie counter, and it also has a lot of cognitive behavioral therapy lessons about eating habits that you might be doing that aren't helpful. And so the lessons are really great. They have a lot of really cute, kind of dorky stuff. So I really like that aspect of that approach, not so serious, having fun. And it's really easy. You're not my first patient that I've referred NOOM to. In fact, since you've been successful, I've been a lot more open. And I hope some of the listeners could see that, there's benefit in just being candid and honest with your patients that, hey, I recognize that your weight isn't where you want it to be right now. And that's probably impacting how you feel on a regular basis. I believe in you. And I think that with this tool, you could get better. And we talked about some other tools and options that I just didn't think would be great for you. You tried some other weight management strategies. You were vegan for a while, which... Yep. As a guy that loves barbecuing, that's kind of hard to watch.
And you're right. You're exactly right. It was too difficult to do. Yeah. It was just too difficult. I feed too many people. I have too many, friends at the house, and I love cooking and barbecuing.
It would never have worked long term for you.
No, it didn't.
When you told me that, I was like, oh.
You were kind about it.
I was like, oh man.
You were kind.
I think I'm excited for you to try this. I'm excited for you to eat vegetables, but I can't see this being great for your long term endurance to this. But yeah, if you want to share with everybody, how much weight have you lost?
So I was diagnosed. Am I allowed to say?
Yeah, you can say.
I was diagnosed with late-stage prostate cancer. It's my second bout of cancer. I was diagnosed in 2014 with testicular cancer, and that's how my relationship started with Ellen. Actually, is getting some physical therapy that I needed after my first surgery, and it was October 2021. I was diagnosed with late-stage prostate cancer. I immediately did some very aggressive radiation therapy that hurt as far as my activity and my my stamina. And then I started on hormone treatment, and I take steroids every day because I also take a chemotherapy drug every day. And the steroids help with the side effects from that. So long story, I put on 43 pounds. Almost embarrassing to say, but I did. I put on 43 pounds.
I really appreciate your bravery in acknowledging that. And I hope you know that so many people have faced medical issues that have caused them to gain weight. And you are really an outstanding person for sharing that. And I appreciate that. But I want you to know that as physical therapists, we see so many people like you, and we're just so nervous to say anything because we don't want to make you feel bad about yourself. And I hope you know I never wanted, so I was seeing you recently. Can you share with everybody, since I don't want to spearhead that, what symptom we were managing over the past few months around the time that I suggested NOOM?
Back issues, for sure.
Yeah.
Neck issues. Yeah. I'm also dealing with headaches along with some of the side effects, and you helped me with the neck and shoulders, but mainly we started with the back. Yeah,
that's really where, and so side note, pain and weight, we'd love to say that they're not reliant on one another, and pain and activity levels are very closely related. Being inactive and pain go often hand in hand, but unfortunately people that have chronic pain are far more likely to be facing issues with their weight. And so it's really hard to separate those out. And so, we can give, as therapists, we feel very comfortable telling people these are the exercises that we can give you for your back pain, but it's really uncomfortable for us to say, hey, if I believe in your ability to change your weight, and I have a tool that I think might help you, I think that addressing your weight would also help your pain. And even if we didn't change your weight, the steps to get healthier, like being more active and eating differently, could very well do that without having to lose weight. So I think physical therapists are very uncomfortable with talking about that. Well, side note, research says that 73% of people think that it's within our scope. I would say before talking with you about NOOM, I had talked with my patients about their weight, maybe 1 in 100. And I bet a lot of the people listening to this would agree that we feel generally like it's really uncomfortable for us to talk about weight with our patients because we don't want to make you feel bad. We like you.
Right. You shouldn't feel uncomfortable about it. You shouldn't. You shouldn't feel uncomfortable. It might make us feel a little bit uncomfortable, but we already feel uncomfortable. We already know. As a patient, I already knew I was overweight. I already knew that.
It's not something you didn't know.
Right. It's not. It wasn't. And the app alone talks about a lot of things, but it talks psychology. It identifies what type of eater you are. It gives you examples as to, and tricks and ideas as to how to change those habits. The other thing it talks about too is movement. It doesn't say exercise. It says movement. So a big part of my issue is pain, of course, but also the fatigue from all the treatment I'm getting.
Yeah.
It was next to impossible for me to get out there for 45 to 50 minutes to an hour to exercise straight. And NOOM doesn't tell you to do that.
No.
It tells you 50 minutes of activity a day. So if I do 10 minutes 5 times a day, that's my 50 minutes.
Yeah, so it does give you that parameter of 50 minutes of movement per day. That's pretty interesting. Yeah, and see, I think that it gave reminders that I'm not going to text you every day to be like, hey, don't forget to move. No. Like, it was up in your business enough that it made an impact on your life. So then, okay, we never got to this point. So we talked about how the treatment had impacted your weight. How has NOOM helped your weight? This is the big reveal.
I've lost 25 pounds since December 22nd.
That is amazing. Yeah.
And it honestly has not been hard.
That's amazing. I knew 22 of them. Those 3 ones are new. So I'm really, I can see it in your face. I can see it in your energy levels. I am so proud of you. And I can't, you really are the kind of person who would do really well with this. And I knew it from day one that you would be successful. I'm really impressed by you.
Can we get back to you asked specifically how I felt about it?
Yeah, that was the big reveal.
Right,
Take it
right.
from here, man.
But I think it's important for everybody to know that you as a healthcare provider, if that's what we need, that's what we need to be told. So if you as a healthcare provider decide that, look, that David needs, and I did, let's be honest, I needed to lose that weight. It'll be easier when I'm off of some of my treatments and stuff.
Oh, yeah.
It'll be a lot easier to get back to where I was,
sure.
the athlete I was, and in the shape I wanted to be in. But you as a healthcare provider, I'm going to tell you as a patient, you have to find a way to address that with your patients.
I think you're right.
You can do it kindly, but you need to find a way. And it's basically, you did it. You asked me a question. Hey, Dave, would you consider?
Yeah.
I'm like, yeah, I would consider. If you ask it like that and they say, no, I won't consider, well, then you know to back off. Then it's the patient that owns it.
Right. That says no. I think a lot of times people, like, this is probably the first time in your life that you've ever struggled with your weight.
Yeah, it is.
This is not somewhere that you've been. And there are a lot of people who struggle with their weight who have been there since they were 6, since they were little kids. Their parents might struggle with their weight. It's ingrained in their world. And I don't want to discredit those people's experiences that they can just bounce back to a weight that I don't want to discredit the difference in your experience versus that person. But I think it's important to at least be open. And you knew that just because you had a weight issue, I didn't think less of you. I didn't think that you were lazy. I didn't think that you weren't trying. I didn't think that you didn't care about yourself, or that you were, because honestly, a lot of healthcare workers are really biased and fat phobic, and they're real a-holes to their patients. I've had so many patients who are told, like, you're overweight, like they don't know. And I think knowing that you have somebody to cheer for you and somebody who's on your team and who genuinely believes in your ability, even if it's a small step in the right direction, I think that's what you have to have in your heart as a clinician. You can't look down the edge of your nose and say, well, you probably deserve it because of how you eat or because you don't move. Can you believe? Like that attitude will never get you anywhere, I don't think, with your patients. So I appreciate you saying that it's our job, because so many of us feel so uncomfortable about it that we neglect a huge part of our job. So I really appreciate your honesty. If I guess we could point, this is going so, where I'm having so much fun talking with you about this. I don't want to keep you here all night. But what are some of the shortcomings, in your opinion, of NOOM, if any?
It keeps track of your caloric intake. It's designed off of 3 colors. Mm-hmm. So the less caloric dense it is, it's going to be a green food. The more caloric dense it gets, it goes down the scale and ends up as a yellow and or as a red food.
Yeah.
So you can eat a ton of green food, and it's going to be anything that's less caloric dense, right? Like all your vegetables, of course. Right. And then as you move down the scale, I'll give you a perfect example. Egg whites is green, but the second you add the yolk, you've now dropped into the yellow and you've added more calories. Well, I'd rather eat more egg whites and not eat the yolk so that I can eat more food and feel full.
Yeah.
Right? And that's a huge part of it. The other part of it too is, you asked me what I don't like about it. Mm-hmm. The point I'm going to get to is, yeah, it keeps track of all that, though it doesn't keep track of your macronutrients.
Yeah.
That's what it doesn't do. And I sometimes I question, am I getting enough protein?
Exactly.
Am I getting enough carbs to keep the energy that I want to continue with? I don't think I haven't felt a problem with it. I read a lot. I enjoy this kind of stuff, and mm-hmm. my education actually background is in some of this. So I already know kind of what proteins I should eat, what proteins I shouldn't eat, and so on, and how much of that protein to have too. So, but for the person that doesn't have any history or background in that, not understanding what the macronutrient breakdown is, it can be a little,
it can be almost like, I would love to know, and I'm sure that there's information overload. I would love to talk with a NOOM exec and be like, why? Because this would be, all that data is already there. They know how many calories you're getting and from where. And also, for some of my patients, knowing how much salt they're getting, how much added sugar, how much fiber, that can be really valuable information. I agree with you. That's probably my biggest critique. Maybe my only critique of NOOM is that they don't include that breakdown of macros in their app. But
they make an assumption. They break down my caloric intake in green. I'm supposed to take in so many green. I'm supposed to take in so many yellows, and I'm supposed to take in so many orange, not red.
They call it orange.
Orange, it's orange. And if I'm doing that and I'm hitting those calories, then maybe there's an assumption that to get to the orange, I have to eat the caloric dense foods, which is going to be your red meat or, right?
Yeah.
But honestly, I attack this straight on, and I'm not hitting my maximum caloric, and I believe that that's why it's working for me so well.
Yeah.
Even though I'm have a hormonal deficiency, and
it's really working for you.
It's really working for me. Yeah. And so when I get back off the hormone treatments, I'm going to stick with the program.
Right.
And and off the steroids and everything, I should be able to go back up to those nutrients and even have more fun eating.
Yeah. Right. And maintain some of those improvements in your weight management that you
exactly.
Yeah, see, I feel like as a PT, being aware of like, I need to know how much your protein intake is important to me as a PT to know, okay, how are things going with how much protein you're getting to supplement or to make sure that you're maintaining your muscle mass. I feel like that's something an extra step for me. Like, I would feel really good with you doing NOOM without me supervising in any way other than me saying, hey, are you... I maxed out my time on Instagram today and I had to adjust it. But yeah, I think that addressing protein intake is super important. And so I felt like as your PT, I couldn't just say, oh, well, be well, good luck, keep losing weight. We kind of had to talk about that. So that's my only real criticism of NOOM. But I really appreciate you coming in and sharing your experience. I'll direct everybody's questions to you. I'll make sure that I get your feedback and post it in the YouTube comments if anybody has questions for you directly. But I just really appreciate you. And you're changing your perspective on the role of a PT should hopefully impact people watching to know that we can talk about this with you, with our patients, without making you feel uncomfortable or like we don't like you or that we're trying to make you feel bad, that we really want to help. Thank you. Thank you for having me and letting me share, actually. Oh, gosh. It's actually part of the NOOM process. I love it. It is. You are supposed to share your successes. So I don't know how many people you got watching, I just shared it. I just put it out there. So well, thank you very much. Yeah. You've done your part, and we really appreciate it. So thank you, everybody who is watching, and hopefully we'll see you guys next week. Thank you.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.